Along the continuum, I guess one way to explain this in layman's terms is you have normal function and then you have mild cognitive impairment, as you mentioned, also known as MCI. You could consider this pre-dementia, and then you have dementia itself. There's many types of dementia. Another reason why we made this podcast is we saw a recent article posted by a well-respected neurologist, I believe.
Yeah, the two neurologists that are sort of in the preventive neurology space, at least in the mainstream traditional medicine. Isaacson, I believe, is the last name of one of the authors on that paper, and I think he was the first at Cornell to have a preventive program, and I believe there's a wait list to get in there. So they sort of posted a broad, overarching review of, what do we know, what do we not know? They highlighted a couple genetic factors, lipids, talked about blood pressure, metabolic health, a lot of really good things in there.
Yeah.
But I guess to take a step back, we'll talk about kind of, what is dementia versus, mild cognitive impairment. So, we're coming from a hospital background. You see these ICD-10 codes, neurocognitive disorder, and you have like mild or you have major. So, mild cognitive impairment is where this person is still sort of functioning at their baseline level.
Yep.
They're able to complete their activities of daily living and pay bills. They may be sort of relying on, lists, reminders. They may be, having some obvious impairments, but they're still able to kind of manage and get by.
Yeah.
And a hallmark of both of these things is that it should not be caused by something else, right? So if you have a profound hypothyroid state, like that's an obvious case that is reversible.
Yep. Severe B12 deficiency. That's another reversible case. Along the continuum, I guess one way to explain this in layman's terms is you have normal function and then you have mild cognitive impairment, as you mentioned, also known as MCI. You could consider this pre-dementia, and then you have dementia itself. There's many types of dementia, so that's just kind of like, it's saying like heart disease. There's obviously ischemic heart disease, congestive heart disease, electric heart disease. With dementia, there's problems with dopaminergic function, like Parkinson's, Lewy body dementia. There's problems with cholinergic function and other things. With Alzheimer's, and with that, it's more characteristic with more amyloid plaques and tau tangles, although now it's kind of controversial whether or not those are just correlated or causatory of dementia. And then you also have other more rare causes of dementia, like prion diseases.
Yeah. So they have a list here of things that, there's different subtypes or things that are, known to be associated with it, just like you mentioned, prion disease, HIV, traumatic brain injury.
CTE would be under that.
Yeah, exactly.
Chronic traumatic encephalopathy.
Yeah, any major insult to the brain, whether that's infectious or someone has had a vascular event, all those sorts of things are going to put more stress and causes an insult to the brain.
Yep. Huntington's disease is another rare cause. That would be another CAG repeat. Listeners of the channel know that we love talking about trinucleotide repeat diseases. Huntington's tends to expand over time. But that's kind of a general overarching view. We're mostly going to concentrate on Alzheimer's. You have early onset and late onset Alzheimer's. Yes, there's some disease states like Down syndrome where you're at risk of more early onset. And then if you're an ApoE4 heterozygote or homozygote, then it's higher risk of late onset Alzheimer's. And we'll kind of get into more of the details.
Yeah, I think that's a good overview. And I particularly like the sort of analogy you made with different subtypes of heart cardiovascular disease sort of falling under that umbrella. There's different sort of vectors that are causative in dementia. So
I should have mentioned ischemic dementia. I don't know why I didn't mention that one. Plaque causing dementia.
Stroke kind of goes along with that.
And that.